Welcome back to NTV Tonight, and now I'm joined in studio by Dr. Abdi Mohammed, who's the chairperson of the Social Health Authority, to speak about the matters of SHA amid what many have described as chaos, Daktari. So let's just begin here. There are so many issues people are raising about SHA. How do you explain this?
First of all, thank you very much. Thank you for having me in the studio. Yes, we might be having issues, but there are many success stories. There are many patients who are being treated, who are getting services. I looked at the dashboard before I walked into the studio. As of at this point, from October 1st, the claims and we have processed is 1.9 billion shilling.
1.9
billion.
Billion.
That is benefits to individuals, because as long as it's a claim, it means it's a benefit to a patient who has gotten services. I can tell you there are many private insurances who will not see those kind of claims even for a whole year. Never. Even if you combine all of them. That already tells you the volume of work for just three weeks of, and this is the one which are in the digital system. There's the first week, which was a little bit chaotic because of the system, where we have some manual claims, which we have not yet reconciled, which is going to happen very soon. So for me, I would say yes, we have had challenges, but we have also had many people who have benefited. The many people include patients who are on dialysis, who have been treated for the last 1 month. The first week, I would say there were a few centers, not all, out of the 220 centers. I would say maybe 20 centers were partially charging patients to pay cash. But by the second week, I think that has stopped. And for now, there's nowhere or there's no patient who is on dialysis, according to my knowledge, who is paying cash out of pocket.
And when you mention that about paying cash, we have our correspondents across the country. And they are still telling us people are still paying cash. Why?
So there could be many issues. So you might find there are people who have not yet registered. So there is, we have 3 funds at Social Health Authority. There's the Primary Health Care Fund, which all you need to do is register and get services from level 2, 3, and level 4. Then there is a Social Health Insurance Fund, which is contributory. So meaning you need to contribute whether you are formal sector or informal sector. So the people who might be having challenges are the people who are in the formal sector, who are not employed formally. So you will find sometimes they haven't done the contribution, maybe in the correct way. Because what's needed is you go through the Afya Yangu portal, you register yourself, you pay, you do the proxy means testing questions, you finish, it gives you the amount to pay. You can go to prompt and pay. So once you do that, then the system is able to identify you. But if that process is not followed, the system will always say you haven't contributed because you haven't done that contribution.
Is that a failure on civic education on your part?
It is a failure in the sense that people have not yet understood on how to go about it. But so we have some...
the communication has not been sufficient?
I would say yes, or you know, not everyone grasps or understands as quickly as possible. But we have said people who have difficulties should be able to go to the nearest branch for SHA and get assisted to go through the process. But unfortunately, what's happening is someone shows up at the hospital, and that's the time now they want to do the process of registration. And I would understand, because for the first time, there's no waiting period, unlike previously for NHIF, which had a 2 months waiting period. So now the advantage is you get services immediately you enroll. So that maybe is what now some people are ending up trying to register when they are at the hospital already. While we have been singing that you register while you are still at home and not sick, and then make the payment. Don't wait when you fall sick. Just make the payment so that when the time comes, which we don't know, no one knows when they will fall sick, that you get at least services seamlessly. Similarly, if you are pregnant also, you don't need to wait until the time when you are about to labor. If you have been going to clinic for ANC, that's the time to do the registration and follow the processes and finish that process before the time comes.
So amid all this, do you feel there's a chance that this was rolled sooner than was ideal? Rolled out, I should say.
Not really, because we have been discussing this thing for the last 2 years.
So where's the disconnect?
No, in everything that you are starting afresh, there will always be a challenge. Even you, if you move from your current house and you move to a new house, it will take you some time before the house settles and you get into a routine that you are now comfortable. So you will have the usual teething problems, which I am sure the first week and the second week and currently is not the same. We have moved from initial manual, week 1 to a system, week 2 fully digitized, moving from 2 providers, 10, 3, now we are at 8,000 providers onboarded through the system who are doing the claims. And getting from 10,000 shilling as the initial claim to 1.9 billion. That already tells you it has been a steady progress over the last 4 months, the last 4 weeks. So if we had waited, which most people seem to suggest, which it just means that we would have waited and continued with the old club, which was NHIF.
Which some are arguing was better than what they're going through now.
It was not, because it was a members club. You needed to have paid up for you to benefit. But SHA, for the emergency fund, you don't need to have paid up. And I think you don't need to have even registered for you to benefit.
I think the argument here is,
yes,
even if it was a members club, as
yes,
you put it,
yes,
if I'm not part of that club,
yes,
I am clear that when I go to hospital, I'm
yes,
paying for myself.
Yes.
But now this one, someone is going to hospital, knowing that it's going to be covered,
yes,
then they're told bring cash or don't get treatment.
No, for those are now where we need to address issues like that. When someone is paid up, and I have told you, as long as you have paid up the correct way, you don't have an issue.
But we've seen politicians.
The problem, you will find that person hasn't completed the process.
No. We did, sorry, for instance, let me give an example, and yes, I can even share the link with you afterwards.
Yes.
Of a lady who was in, their family lives in Wasingishu County.
Yes.
She went, and they even showed the messages of how they've registered. They were paid up on NHIF and even on SHA.
Yes.
All right?
Yes.
So both sides. But when she got there, the hospital said they can't, hospital in West Pokot.
Yes.
And she had to go back. She was going for dialysis.
Yes.
Before, then now they had to, she was told to pay about 8,000 bob.
Yes. 80.
Eight. Nane. Okay?
Mm-hmm.
She couldn't afford it, so she went home, and their family is not a family of means.
Yes.
So they were trying to pull together resources. Before they could get the money together, the lady passed on.
So you see, this is the other thing that you need to realize, that we have said, even where the system is not working, and that is the memo that we have sent to all the providers. Mm-hmm. And I would say that is an errant provider who has done the wrong thing. We said all patients who are on cancer treatment dialysis should get the services. and deal with the issue of paperwork separately. A system is not what treats patients. It's the hospital and the doctors and the clinicians who are in the hospital. So that is something that we have given to all the providers, that there is no patient who should be denied any services, especially patients with chronic diseases.
Okay.
And that's the first memo I think we have sent in the first week.
Okay,
yes.
And we'll pick up on that
yes.
about the errand providers, because we then need to know what happens after that. We take a short break on NTV Tonight. In the course of this conversation, we have picked up a few things from the chairman of the Social Health Authority, that's Dr. Abdi Mohammed, and we shall be having more questions for him and more conversations to help us understand and explore this matter of the Social Health Authority and the Social Health Insurance Fund better. Stay with us. Welcome back to NTV Tonight, where we're having a conversation with Dr. Abdi Mohammed, who's the chairman of the Social Health Authority. And Daktari, before we went for the break, excuse me, you talked about in the cases where you see people being told to pay cash and they're denied service, those are errand providers. So what has been done to these errand providers in your terms?
No, for us, what we need is to find out the patients or the public to complain to our branches so that we are made aware the providers that have an issue. We have contractual obligations, and that's what we will take action on, even if it means terminating the contract. So there are mechanisms on how we will handle that dispute between SHA and the providers.
So as it stands,
need to be made aware.
So as it stands, do you have any cases that you're handling?
So far, none has come to our attention.
But we do know there are people who have suffered.
I have told you, it will depend on what exactly is the issue. You see, you might find someone has gone there, maybe made payment to the wrong pay bill, and they can't be seen. For me, I will not fault the provider at that point, because for them, all they need is to say, I can't see you. And if they can't see you, that you are paid up, of course, they will not take the risk to treat you.
So are we saying that there have been no complaints brought to you formally, or is it that the ones that you have found, none has implicated the service provider?
We haven't yet. I am not aware of any, unless now the management have received that and they haven't brought to the attention of the board, where we have specific providers that they have investigated and found out that they denied people services, and the patient had no challenge with their card.
Doesn't this worry you, that we have people complaining? Like, I mean, we were speaking and you were saying that there's been a lot of negative press.
Yes.
And negative press, in this case, just being that there's been a lot of real stories of real suffering being told, but there's no one who's really been held to account for the pain that people have gone through.
So you see, when we get now such a story, what usually happens is the management finds out what was the challenge. So they will find this is an isolated issue, and the problem is not the mistake of the provider, because the same provider is seeing so many other patients. At the same time that you are reporting this one issue, you will find there are many other patients who are undergoing treatment in that same hospital. Because I see the dashboard and I hear there's a problem in facility X for one patient or for one case. Then when you look at the same facility is also seeing so many other patients. So you will have to find out what could be the problem. And that's something that can have easily been solved if that was raised either with the provider or with the SHA offices within the locality. They should have been able to solve that issue. But unfortunately, that is the only thing that we see. In the same facility, if your colleagues walked around and asked, are there other patients who are being treated, they would have found thousands or hundreds in that facility. But that doesn't sell.
It's not about selling, Daktari.
No.
This is what is meant to happen normally in a hospital, right?
Yes.
So whatever is out of the normal is what then becomes a concern, which is what then has been reported.
But you see, you need to reach to the bottom of that issue. What could have been the problem, and reach out to the SHA offices and find out why is this patient having
But
an
SHA
issue.
says it has no reports.
No, I'm saying, you see that patient you walked around with and found that they have an issue. I wish that could have been taken up with the branch leadership within that locality to find a solution. And I'm sure they would have found a solution where the issue is, and it would have been addressed, and the patient would have gotten the services that they need. So without being humiliated on camera to show that they are suffering.
So this for me almost sounds like there's a challenge on communication, because if people are not fully understanding it, is it that the communication has not been effective?
I would say it will take some time. For sure, for certain, it will take some time before people fully comprehend. If today I go outside and I ask about NHIF, there are many people who have had that card for the last 10 years and have no clue how it used to work. So I understand because I have been in the business, I have been a provider. And there are many people, even you, if I had asked you, what were you entitled to in NHIF, you wouldn't know.
Just a bed.
Now you see. That already tells me that you do not understand. And I wouldn't blame you, because that's not your day-to-day activity for you to ask around what is it. But for SHA, I would say we have even tried. Do you know we have, for the first time, we have gazetted the benefits and the tariffs. And that is something that is in the Gazette notice. You will find how much is even that bed that you're talking about. How much are you entitled to dialysis? How much are you, and I wish that is now where now you guys would be able to help us communicate and people to understand that these are your benefits, these are the tariffs that you will be paid for, these are the providers who have been contracted to provide these services. That way we will all be able to do. But if we are the only ones who are supposed to do, it will take us some time, but we will reach with time.
I'll tell you for a fact, Dr.
Yes.
We have done the story on the benefits.
Yes.
As a group, we have done the story on the package, on what people are entitled to.
Do you know which one you have done? The dental. That is the only one that I have seen.
Well, that's the one you have seen. I'm glad you've made that clear. Not the one you have done.
Repeatedly being shown that dental is 2,000, 2,000, 2,000. But there is so much other benefit. There are almost hundreds of surgeries ranging from 10,000 shilling to 1-point-something million, which is a benefit to individuals. There is transplant, which is a benefit for patients who have kidney diseases, and the amount is 700,000. But now has other benefits that come with it, including pre-transplant assessment, which was not there before, and post-transplant treatment, which was not there before. And it moved from 500,000 to 700,000. So you see, those are the kind of benefits that I would expect is what, and even where to get the document. For the public to know, how do I access this document? What are these benefits? What are these tariffs? And how do we participate even next time when these benefits and tariffs are gazetted? How do we participate in changing some of them, in increasing the prices for some of them, which we have also indicated in our regulations. There's a whole committee where even the civil society is represented to sit down and review these tariffs and benefits. Previously, it used to be an NHIF affair to come up with these benefits and tariffs on their own. Now we have a committee that has experts from the different players in the sector, including Ministry of Health, SHA, university, experts, civil society, providers, and clinicians, to look at it and say, this is what we have, and this is this disease burden has increased in the society.
Okay.
This amount is not enough. So
Okay.
to look at how to engage with that committee.
And just for the record, I have here with me a story done on nation.africa,
Yes.
which is talking about the benefits of not just dental.
Yes.
Talks about deliveries, talks about dialysis, talks about oncology. So just as a matter of setting the record straight, we have that. And the thing is, Daktari,
yes,
while that may be good,
yes,
people's attention has been drawn to one, the fact that there are people who are suffering
yes,
when they need not to.
true.
They are suffering,
Yes,
yet some of them have complied with what the government has said, but they still end up being victims of this new system. And I think it's something we have to appreciate, all right? I'm curious, one of the things that has caused a lot of this uproar is that there's a lot of cynicism towards the government. You know, and this is why anything is said, that's linked to the government and there's uproar about it. How are you handling that? Because that may be one of the biggest thorns in your flesh.
I'm happy you said there's a lot of cynicism, which sometimes is not a reality. It's just general cynicism. And the general cynicism also can be created on what you feed on. Because if you happen to get negative news constantly, where there is no feel-good story, none that you see, you will become cynical on everything, even when there is a good thing. Even when there is a good thing for you, you still don't believe.
But you know there are people who still are cynical and they say they don't watch news.
Exactly.
So that means it's not just about seeing news. It's about their own experiences.
No, it is what they consume also. You know, news is not just only what you watch on. It's what you receive as a forward. Sometimes which is fake. But because you don't have the leeway to check, or because you have already believed that there was a problem, even when you get a fake news, you still believe it's true, even after you have been told it's fake. So you see, that is what I mean. When you constantly receive the same thing, being told the same thing, that there's a problem, there's a problem, there's a problem, there's a problem, and no one is saying there's something good, that is, no amount of communication will change unless you are able to, that cynicism or that fake news or that negativity also balances.
But Daktari, we cannot negate people's experiences.
True. So
it's not just about fake news and what the news that is being shared, true or not. There's also people who have gone through such difficult experiences that it's not even about what they were told, it's what they have gone through or are going through.
And there are many who have gone very beautiful stories.
But there are many who have suffered.
But no, the number is completely opposite. You will find 98% have good experience. Only 2% might be having a challenge.
Let's not negate the 2% of lives.
I'm not negating. That's why I'm telling you. So that we also, that's where I'm talking about the issue of balance. That yes, there will be, and there are a few who have challenges.
Okay.
I'm not saying it's 100%, but I'm telling you there are 98 to 99% who are very happy with what they have gotten so far. But their story is nowhere. No one has asked them. There's nowhere they will come out. But in this day of social media, even without being asked, people share their experiences, right? I have seen. If they're not sharing themselves, you should question yourself, I think. Because no. I have seen many positive stories, individuals sharing. But
you say their stories are nowhere. Like
no. They are individuals. They are not carried in your media. That's what I'm talking about. They will share on their WhatsApp. They will share on their Instagram. They will share on their Facebook. I have seen those stories.
Okay.
Where someone says, I got approval for pre-authorization for surgery within 1 hour. Previously, that used to take a whole week.
Okay.
You seek pre-authorization, you wait for a day, 2, 3, 4, 5, a week. And that's when it gets approved. But now, our turnaround time is 1 hour. Actually, 68 minutes. That's what the dashboard says. 68 minutes is what we are getting as a pre-authorization approval.
Okay, and again, for the benefit of those who may be watching or who will watch this and have been feeling like, we've seen frustrated people saying, let's go back to NHIF, right? Just for clarifying that, just for the benefit of clarity, what was missing in NHIF that people will now benefit from, you know, SHA?
So the first thing is you need to realize, as I have said, NHIF was for members club. So you needed to have been a member and paid up for you to benefit. Secondly, if you are in the informal sector, you needed to pay now and wait for 2 months for you to get benefit. That has been moved away from SHA. You pay now, you get services immediately. Secondly, you don't need to even have registered for you to benefit from emergency. Emergency fund is a right in the Constitution that has been given in the 2010 and that has been also put in the 2017 Health Act, but never implemented. This is the first time it has been implemented, and it's only available because of SHA. Previously, under NHIF, there was nothing. If you had an emergency, you paid out of pocket, or you had a card which was active, which was paid up. So this one, you don't need to be a member and you don't need to have registered. Secondly, there is a primary healthcare fund, which also all you need to do is register for you to benefit from primary healthcare in level 2, 3, and 4. If you go back, that's not available for people, especially the poor and the people who are in rural areas who have never registered. For now, they don't have to worry about that primary healthcare level 2, 3, and 4 services. They will get it for free. So what I have not understood is why someone would say, let's move away from this, which has benefits for even when you are not paid up, even when you are not registered, and move to a place where it was a private members club. So the other thing that you need to realize is NHIF did not have a fixed amount on what was the administrative cost. It was an open check. So it could move from 10, 12, 15, 20, 30%. For SHA, that has been capped to 5%. So already 95% is for service delivery, which was not there before. So if you look at again on the issue of empaneling providers, you had to wait for 2 years for a facility to join NHIF. Currently, all that process has been reduced to even a week because the e-contracting is online. You don't need to know anybody. All you need is you have been licensed. That is reflected on our portal that you have been licensed by KMPDC. And all you need is just to go to the e-contracting portal and you sign up the contract. That also is different. The benefits and tariffs. Previously, no one knew what was your benefit, what was your tariff, what were you entitled to, how much were you going to be paid for. That was in between the hospital and the NHIF. Now it's a public document. You as an individual, you are aware of what is your right, what you are entitled to, so that you also, you can also participate in shaping how that benefit and tariff is arrived, and it's reviewed after every 2 years. Lastly, previously there was no dispute resolution mechanism. Currently we have a tribunal set up by the Judicial Service Commission, which is supposed to address all disputes between providers and SHA, between patients and SHA, which is able to address that issue. So that was also not there, which now is there. So if you look at progressively, you will realize that the two are not the same. One is way much improved. And when people say reform, the way I understand the word reform is to change something. So we have changed to a better institution that has extra benefits for everyone. And the idea is now for SHA is to provide universal health coverage. Universal means we are onboarding everyone, whether they are able to pay or not able to pay, so that you have something that you get as a health coverage.
All right. And I mean, you said that you wonder why people would want to go back to the old system, yet this one is better. I would give you 3 C's. Certainty, because in the old one, they were sure I'm not covered here, so I will pay. Based on, for those who have gone and have been told to pay cash, there was a certainty of I'm covered or I'm not, so I'll cover myself. There's cynicism and communication. In my view, based on the conversation you've had and what you see people talking about, there is that challenge. I'm curious, how many facilities have been have so far been accredited to offer services under SHA? You said it's 8,000?
8,000 plus. I will give you the exact number.
And do we have any idea, any indication of private, public?
Yes. Public is all. From level 2 to level 6 for public facilities. I would say similarly for mission is almost all. Private is what we have around 3,000 providers. Yes.
So the majority is the public and the mission combined?
I would say the majority is public, then you have private and mission, which also almost equal to the public when you combine the 2, private and mission.
And do you have any facilities that have not been accredited so far because of failing to reach the, the SHA regulations, to attain the SHA regulations?
No, you see, to be signed, we have empaneled all providers, and that's 12,000 facilities. But there are those who now opt out, or the services that they offer are not part of the benefits and tariffs. For example, if you offer hair transplant, we don't pay for that kind of.
It's interesting that you talk about hair transplant.
I know I need one, but it's not covered. So you see, for that kind of facility, we will not contract because there's no benefit in that line. So those are the kind of providers. Or if you are a private facility that maybe wants to cater for high-end clients with private insurances, you might opt out, especially for outpatient. Or you are a consultant, for example, gynecologist or a specialist. So we don't have a tariff specific for consultation to a consultant. So you will not be able to be contracted.
Okay. And just my final question, there were issues raised regarding the tendering process for the digital platform. Where are we with that?
That's, I think, with the Ministry of Health. It's not with SHA.
Okay.
Yes.
So that is out of your...
it's out of my
jurisdiction. Okay.
Yes.
Thank you very much for speaking to us, Dr. Abdi Mohammed, who's the chairperson of the Social Health Authority, and for seeking to get things straight.
Reduce the C's, especially the cynicism, and improving on the communication. Certainty will come. It's just a matter of time once people understand, especially people who are left out before, who are never with NHIF, but who now start benefiting. They will start realizing that there's something which was not there for them, but is now available.
You know, when you talk about with time, it's the same thing that has brought some heat towards the president when he said, give us some time and have some faith, because the argument has been illness, accident, doesn't know, give me time. Or
but for those patients, as I have said repeatedly, we are able to sort out immediately.
Which in some cases has not happened, and that's where I think the issue comes for many people.
And I understand sometimes maybe the communication on where to report is the issue. For me, I would say, please report to the nearest SHA office, because in this country we have over 80 branches, meaning in every county there is a SHA branch, we have the call center, which is also 24 hours. So whenever you face those kind of challenges, I would urge Kenyans just to reach out so that your issue is addressed there and then, rather than waiting or suffering in silence.
Okay.
Yes.
Thank you very much, Dr. once again for joining us on NTV tonight and for your indulgence. And that does it for NTV Tonight on this night when it's the eve of the swearing in of the incoming Deputy President, Professor Abraham Kithure Kindiki, and there'll be a lot of activity tomorrow. Remember, we shall be live on NTV from 6 a.m. giving you full all-round coverage so that you can not miss a bit at all. Thank you for joining us. My name is Dan Mwangi, alongside David Agondoa, who has been on the sign language interpretation. Have yourselves a good night.